Perfect. All right.
And then Ian.
Will the Senate please come to order? We'll take a moment of silence in lieu of a devotional this morning. Thank you. Are there any announcements? Senator from Chittenden.
Mr. President, I have never seen an unacceptable word in our calendar. But if senators will look on the first page toward the end, there's a pending question. And I
see it, Senator.
would ask that we consider that a Scribner's error.
Senator from Chittenden, I have been made aware that that was a test, and it appears you're the only one that read the calendar.
Thank you.
Wow.
We have H 650 being on the calendar for notice and affecting the revenues of the state under Rule 31 is referred to the Committee on Finance. We have H 938 being on the calendar for notice and carrying an appropriation under Rule 31 is referred to the Committee on Appropriations. Orders of the day. We're going to start with third readings. And we start with H171. Are there any amendments prior to third reading? Senator from Windham.
Yes, thank you, Mr. President. The amendment is being handed out. It's very short. I discussed it with the Judiciary Committee this morning, and what it does is it adds in the listing of items that this group will look at. This is the group that is working on the existing mechanisms that we use with an officer-involved shooting, and also looking at potential changes to that process. That what the amendment does, it says that in Section 1, officer-involved shooting protocol, in subdivision C5, after independent assessments, which is one of the items that they need to look at, it adds in the role of victim advocates. And victim advocates were not included in the bill, and I understand why they're not included in the group that is going to be doing the work, because the folks who are doing the work are the folks who actually do the investigations. But this amendment includes the role of victim advocates in the conversations. So I request your approval.
Senator from Windham.
Thank you, Mr. President. Senate Judiciary heard the amendment this morning. We had a lot of conversation about adding different entities to the actual working group. Where we landed with this amendment, the committee is supportive by a straw poll of 5-0-0 to adding the words "and the role of victim advocates" to subdivision C5. I was able to connect with the Attorney General's office and the Department of State's Attorneys and Sheriffs. They have a neutral stance on this change. The Center for Crime Victim Advocates was supportive of this language. And so again, by a straw poll of 5-0-0, the Judiciary Committee supported this amendment, and we ask for the Senate support.
The senator from Windham, Senator Harrison, has moved that the bill be amended as offered in the handout. Are you ready for the question? If so, all in favor say aye. All opposed, nay. Ayes have it, and the motion carries. Are there any further amendments prior to third reading? Seeing none, listen to the third reading of the bill.
H 171, an act relating to criminal justice agency protocols for an officer-involved shooting.
Question is, shall the bill pass in concurrence? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. The ayes have it, and we've passed H 171 in concurrence. We now have H 577 for third reading. Are there any amendments prior to third reading? Seeing none, listen to the third reading.
H 577, an act relating to establishing the Vermont Prescription Drug Discount Card Program.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we've passed in concurrence with proposal of amendment H 577. We now have H 588 for third reading. Are there any amendments prior to third reading? Seeing none, listen to the third reading of the bill.
H 588, an act relating to professional and occupations regulated by the Office of Professional Regulation.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we've passed 588 in concurrence with proposal of amendment. We now have H 611 for third reading. Are there any amendments prior to third reading? Seeing none, listen to the third reading of the bill.
H 611, an act relating to miscellaneous provisions affecting the Department of Vermont Health Access.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? If so, all in favor say aye.
Aye.
All opposed, nay. The ayes have it, and we've passed 611 in concurrence with proposal of amendment. We now have H 635 for third reading. Are there any amendments prior to third reading? Seeing none, listen to the third reading of the bill.
H 635, an act relating to eliminating Department of Corrections supervisory fees.
The question is, shall the bill pass in concurrence? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we've passed H 635 in concurrence. H 657 for third reading. Are there any amendments prior to third reading? Senator from Addison.
Thank you, Mr. President. There'll be an amendment passed around here for 657, Section 16 of the group, working group, and we're asking to add the Women's Center of Middlebury, Vermont to be in the group to assist in helping any individual that is going through a pregnancy. The concern for me was when I saw Planned Parenthood that the individual decides to have terminate the child, that they have resources, that they have help afterwards, and that they have resources also beforehand to make a clear decision on what they want to do. I met with the committee this morning. Overall, good reception. So I ask the Senate for their support.
Senator from Chittenden.
Thank you, Mr. President, and thank the Senator, Junior Senator from Addison for bringing this to us. And it is important that full support be given during pregnancy and post-pregnancy or pre-abortion or post-abortion. And the group at the Women's Center located in Middlebury has that expertise, as well as does Planned Parenthood has significant expertise in this area for many years. So the committee on a majority of, in a straw poll, a majority agreed to support this proposal amendment. Thank you, Mr. President.
So Senator Heffernan has moved that the Senate propose to the House that the bill be amended as you see in your handout. And the question is, shall the amendment pass? Are you ready for the question? Senator from Chittenden.
Thank you, Mr. President. May I interrogate the proposer of the
The
amendment?
proposer is interrogated.
Mr. President, does the senator know of another women's center other than the one located in Middlebury in Vermont?
Mr. President, thank you for that question. I was neglecting saying that there is actually 8 other pregnancy centers throughout Vermont that would more than likely want to contribute. However, many of them have not been asked yet, and I thought it was important that we at least get one on there that we can open it up for the others later on. Thank you, Mr. President.
I thank the senator. Mr. President, that's actually exactly my concern, is that when we do what otherwise seems like a benign or friendly amendment, if we're very specific in naming a designee that only has a particular geographic location in the state, then we run the risk of setting a precedent that we are going to continually be very specific about a geographic location being represented rather than organizations that function statewide. I know that this is not the end of the bill's journey. So given that it's third reading, I will not ask to modify the amendment. But I would just hope that we try not to set a precedent around a location that isn't necessarily a statewide organization unless it's strictly necessary for the purposes of the bill. Thank you, Mr. President.
Senator from Addison.
Thank you, Mr. President. I agree with the Senator 100% on her view. The reason that we did not add the other 8 was we did not get confirmation in time to see if they wanted to be. I'm hoping as the bill goes on, we can add, because they are literally all around Vermont, and I think it would be a great asset in this bill. Thank you, Mr. President.
Question is, shall the bill be amended as offered by the senator from Addison? Are you ready for the question? All in favor, please say aye. Aye. All opposed, nay.
Nay.
The ayes appear to have it. The ayes do have it, and we have amended H 657. Are there any further amendments prior to third reading? Seeing none, listen to the third reading of the bill.
H 657, an act relating to various programming and requirements within the Department for Children and Families.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? Senator from Orleans.
Mr. President, I was posed a couple of questions yesterday on the bill, and the senator from Windsor asked about something that she thought occurred in Vermont, and it did. And without knowing all the details of the situation, she spoke of if the building was licensed or regulated by DCF and/or a child there was in custody of DCF, then the updates to the statute in this bill would indeed apply. And then also the senator from Woodstock asked some questions about data concerning restraints. And 461 total instances of restraint or seclusion were identified by DCF in the Office of Child, Youth, and Family Advocate in 2025, compared to 324 in 2024 and 92 in 2023. And I think I stated yesterday that she was concerned about the rates have been increasing. Also, 13 children experienced 10 or more restraints or seclusions. And also, transgender youth experienced at least 13% of all restraints in 2025. Thank you, Mr. President.
Are you ready for the question? Question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we've passed H 657 in concurrence with proposal of amendment. We now have H 660. Are there any amendments to be offered prior to third reading? Senator from Franklin.
Thank you, Mr. President. Being passed out, what I consider, in my opinion, a very non-controversial amendment to H 660. It simply adds on section 6A. I'll wait till you all get it here. I did meet with the Health and Welfare this morning. I don't know what their straw poll vote was, but I'm sure the chair will let us know. So moving on, you all heard my concerns yesterday about the syringe program and how I support one end of it as far as saving lives and the opioid deaths going down. But I'm concerned about the other end of it, as these needles, syringes being strewn all over our townships and cities and whatever else. And so I'm looking for a little accountability. So in this amendment, it says on or before December 15th, 2026, the Department of Health shall submit a plan to the House Committee on Human Services and the Senate Committee on Health and Welfare containing recommendations for the implementation of one or more syringe recovery models throughout the state to enhance public health and safety. The plan shall require syringe service providers to report to the department on the percentage of distributed syringes that are returned to the provider or otherwise collected. That's basically simply the amendment itself. And I know that in taking or hearing testimony this morning, they have some of this ongoing presently, but it would have been nice had they let us know about it and actually had that data available for us. So anyways, I'll close with this, Mr. President, and we'll go from here. Thank you.
Question. Senator from Chittenden.
Thank you, Mr. President. And thank the senator from Franklin and others for bringing this proposal to the Senate Health and Welfare Committee. The return of syringes and the work to clean syringes up out of neighborhoods and areas is something that has happened previously in particular in Chittenden County in Burlington, and that program ended. Was through the Howard Center, and now the Department of Health has picked that up and is looking to expand it across the state with the grants that are given out for the syringe service program to reach a 95% return level. So this proposal of amendment supports that process, and your Committee on Senate Health and Welfare did a straw poll in support of this amendment. Thank you, Mr. President.
Question is, shall the bill be amended as offered by the senator from Franklin? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we have amended the bill. Are there any further amendments? Senator from Essex.
Thank you, Mr. President. I want to thank the Senate Health and Welfare for graciously allowing me in this morning to present my amendment. Just some thoughts before we all have the amendment in hand. 45 states across the country have experienced reductions of 25% or better in opioid addictions and deaths. Which I think is very significant. And there's a lot of reasons for that. One is because of the actually settlement fund in itself. A lot of states have severe restrictions on how those funds can be used, with most of them gravitating towards funding preventive measures like having places of recovery instead of what I think there's a few things in this bill that go in the opposite direction. I think that we're winning the battle, and I see that the changes I'm trying to make in this bill will help us get there. Vermont tries to lead to be first in so many things in the state and in the country, and some I agree with, some I don't. I do agree that I would love to see Vermont be the shining example of how we could get our population from 170 deaths to to zero, which I know is a very laudable goal, but I believe that we could probably get there. My amendment is simple to me, and I realize it's probably not as simple to others. It takes the $850,000, this syringe program, and puts it into state-approved recovery efforts, and also the $1.1 million in the monies that are proposed to fund safe injection sites, and puts that into recovery as well, putting that fund, I don't have a copy of it, but putting that fund at a little over $3.5 million to help support people who are addicted to recover. I said in committee, and I'll say it here so the rest of the floor can hear, the senator from Orleans and myself had a friend a year ago who passed away from cancer. And where we do like to call addiction a disease, our friend passed away from cancer. She was able to defeat it temporarily while she was in high school, and had her kids, and as she was getting into the prime of her life, that cancer came back with a vengeance, and eventually took her life. If we were to have offered our friend the chance of saying, hey, we can ensure that you will be cured in 90 days if you decided to take that, would you do that? And of course, 1,000%, she would have said yes. So we have that chance to save a lot of lives in Vermont by offering that chance. I get that there's a lot of denials in life as far as whether you just have bad habits, whether you eat too much, whether you drink too much, whether you spend too much money in one area or another. And I think the worst thing that you have is if you're an addict and you're not ready to make that decision yet, it is very, very hard to convince those people to make those decisions. But I think the thing that can help us get there is to have more opportunity for folks to know that when they make that choice, that decision. Sometimes as an addict it's a moment of weakness when they continue to be an addict. They also have that moment of weakness when they decide that they've had enough. And to not have that place to where they can go to a ready place and have to have them wait for 3 or 4 days. Sometimes that decision is taken away from them being of making the right decision by having the life of an addict. There should be no harm in having extra beds available should those people make that decision. And I think that if we could properly fund these places that want to cure people from the disease of addiction, that we should be ready and standing and ready to take those people on. So again, to me, the amendment is simple: to take $850,000 from the needle exchange, to take the $1.1 million from the place in Burlington, and put it into recovery homes approved by the state of Vermont. Thank you, Mr. President.
Senator from Chittenden.
Thank you, Mr. President. I will say initially that the committee voted unanimously not to accept this proposal. But I would like to respond a little bit to the amendment that's before us and remind ourselves that the syringe service program is helping people. It's providing harm reduction, preventing disease. We know that HIV and we know that Hep C, terrible liver disease, also are prevented when clean needles are utilized. We're not enabling people to continue their addiction. What is happening within the OPC is an opportunity for people to come and be exposed to treatment, to counseling, to cleaning themselves up physically, to having an opportunity to recognize what their own predicament may be. And also to understand that within the OPC and within addiction, it's not a choice. It's not a matter of denying. It's a matter of seeking recovery that could take many, many, many years. People go in and out of recovery and addiction. It's such an awful place to be. So taking the money away from the OPC, whether or not the OPC actually happens. It will, we hope it will, as promised, it may not. There may be some decisions within the city of Burlington regarding that facility. Whether or not it happens, we know that these folks need the support that is promised within that organization. And then in terms of canceling the syringe program, remember, I think I shared yesterday that the syringe program is greater than just syringes. It's also sharp boxes for returning old syringes. It's treatment and counseling. It's xylazine and fentanyl strips for testing. It's wound care and education for folks. So it's a full program. And as we just approved the prior amendment that will allow for the Department of Health to continue its work in collecting used syringes, I find that this would be contrary to that pilot program and that work that's going on. So there are a lot of reasons for not supporting this. And the last one, I guess, is we don't know the effect on recovery beds in the state. We don't have capacity right now, workforce or other capacity, to expand what is being asked for in this proposal amendment, understanding that the intent that I've heard from the senator is very meaningful. But the committee does not support this proposal. Thank you, Mr. President.
Senator from Essex.
Thank you, Mr. President. We actually do have capacity in the state. We have 17 beds in Newport. We have all throughout the state. We hear from folks that could certainly take on more people who wish to be recovered, but there seems to be a shortage on money. So I would disagree with the senator's assessment of that, but I am appreciative of the committee hearing. Thank you.
Question is, shall the bill be amended as offered by the senator from Essex? Are you ready for the question?
Roll call.
Roll call has been requested, and when the vote is taken, it shall be by roll.
Mr. President,
Senator from Chittenden.
may I ask for a 5-minute recess?
We will take a brief recess.
I'll send her a note.
Will the Senate please come to order? Senator from Chittenden.
Thank you, Mr. President. I would ask that we postpone action on this bill until later today and move to the next bill on the calendar.
Without objection, we will postpone action on 660 and move to the top of the calendar.
Mr. President, could I ask for a brief recess, please?
We'll take a brief recess. Senate, please come to order. We'll move to the top of the calendar, starting out with S-227. S-227 was passed by the House with a proposal of amendment. The question is, shall the Senate concur in the House proposal of amendment? Senator from Chittenden.
Thank you, Mr. President. I will offer the bluff in the spirit of my colleague from Rutland County. We took a straw poll on the House proposal of amendment and found it favorable unanimously, though missing Senator Williams. The minor, I would say that we considered the changes they made minor but clarifying and helpful. Those amendments included things like clarifying that all schools that are licensed to operate within the state of Vermont, all of our independent schools and public schools need to follow this model guidance that's being developed. It gave more responsibility to the Agency of Education to help develop and communicate that guidance. And the amendment that is being passed out, or it's in the calendar. The amendment that's in the calendar, Mr. President, on page 2820, largely reflects our agreement with further proposal of amendment to make sure that independent schools are included everywhere that we reference all schools falling under this policy, as well as a discussion that our committee had about managing the presence of immigration officials in school buildings without fully impeding their legitimate use of a search warrant to find a specific individual. So those were clarifying amendments on the part of your Senate Education Committee. And we ask for the support of the Senate to concur with S227 as amended by the House, as further amended by your Senate Education Committee. Thank you, Mr. President.
The question is, shall the Senate amend the bill as offered? Let me see. Okay. Senator Rom Hinsdale has moved that the Senate concur in the House proposal of amendment with further proposal of amendment. Are you ready for the question? Senator from Rutland.
Thank you, Mr. President. I just want the body to know that I wasn't here because I couldn't be here, but I would have voted no on this amendment primarily because this model policy puts the administration of any school in a tenuous situation should this event happen with a federal agent showing up with a search warrant. You're asking the administration to be judge and jury and decide where and to confront the federal agents when they're acting on a warrant under the conditions of the U.S. Constitution. Therefore, I just want to make that statement. Thank you, Mr. President.
Are you ready for the question? Senator Rom Hinsdale has moved that the Senate concur with the House proposal of amendment with further proposal of amendment as you see in your calendar today. Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay.
No.
The ayes appear to have it. The ayes do have it. And we have further amended the bill. We now have S230, which was passed by the House with proposal of amendment. The question is, shall the Senate concur in the House proposal of amendment? Senator from Chittenden.
Point of inquiry, have we passed the full bill S227?
Yeah, we did everything in that one question, Senator, because of the way it was phrased.
Oh, okay. Thank you, Mr. President.
I recognize the senator from Chittenden for S230.
Mr. President, I believe the chair has asked that we pass this over, much to the chagrin of the pro tem, until tomorrow, when we will definitely have a floor report tomorrow, but not today, Mr. President.
Senator from Chittenden.
Thank you, Mr. President. If we could move directly to S327.
With apologies, Mr. President.
Okay. It's all right. No, we're good. S327 was passed by the House with proposal of amendment. The question is, shall the Senate concur in the House proposal of amendment? Recognize the senator from Windsor.
Thank you, and the answer to that question is yes. the Senate would like to, the Senate Economic Development, Housing and General Affairs Committee proposes to the Senate that we concur. And on a straw poll, we voted 5-0 to concur with the House. It's come back with our work largely intact, some modest changes, but there were 4 additions which we are going to call out and discuss. The first one is that in addition to our the culinary, the work on culinary and hospitality, reestablishing and rethinking post-secondary education and possible institute on that, that they've also added an apprenticeship opportunity, which is quite exciting, we think. It adds in section 10B, the hospitality and culinary apprenticeship pilot program, to be administered by the Department of Labor. This program will be developed through the Vermont Registered Apprenticeship Program and will be structured as a regional multi-employer model. So in a region that has a very strong culinary career and technical education program, we see rolling it out around that center. So it might be Killington that has Stafford, it might be Rutland, whatever, but it would be sort of probably dependent on the strength of the CTE program that services that regional area. And so we supported this, and we'll hear, it's a 2-year program, a 2-year pilot, and we'll hear back about that in 2 years. And I think we're all quite excited about that. The second change that they proposed is the Rural Industrial Development Grant Program, which we had not included in our bill. And this makes changes to that Rural Industrial Development Grant Program. The program was originally passed by us in 2023, created in the budget, and is being moved from the budget language to Title 10 where it belongs. So it's easier for applicants to learn about the details of the program. This bill expands the program to consider applicants looking to develop properties that are considered federally impacted. So whether it was the EB5 disaster or a federally declared weather disaster, all those projects would be available for these grants. This includes properties owned by the United States, sort of like the post office here in Montpelier, or that are under custody of a federally appointed receiver, like the EB5 properties. The bill also increases the award amount to 50% of the total project cost, with a limit of $1 million per award. And the ACCD can increase the award to $2 million if the program is federally impacted and is in a designated downtown development district or in a rural economic area partnership program or a federally declared natural disaster within the last 5 years. So we see this as a terrific opportunity. This money has been sitting with ACCD for a couple of years, and this will enable it to be used, hopefully to help fill that hole in Newport and to address the disaster in the middle of downtown Montpelier, the post office building. So we approve that and support that 100%. The next change is in the nickel rounding section, which is 13A and B. And this, as you all know, the penny has been phased out. And so retailers have actually for a while been solving this problem and rounding up and down. This provides some science to that, and it gives retailers clarity and cover for what they are currently doing. This was requested by the Vermont Retailer and Grocers Association. This is both retailer and consumer protection, and it puts into statute that they're able to do this symmetrical rounding up or down. And this is, I will remind you, only with cash, because obviously credit card and debit card payments, you can do to the exact amount. But you will see that this is a may, it's not a shall, and it doesn't affect taxes. And retailers are already doing this, and this puts it, gives them, basically provides statutory coverage for them to do what they're already doing. So that is the nickel rounding system, which has been passed and which we supported. And for CPACE, which you will all recall the commercial property clean energy piece that we passed from the Senate Natural Resources and Energy Committee. We passed this earlier this year for a variety of reasons. It got incorporated into this bill, and I would yield to the senator from Washington and the chair of Senate Natural Resources and Energy to remind us about CPACE. And with that, we would ask for you to, after that, we'd ask you to join us in concurring with the House. Thank you.
Senator from Washington.
Thank you, Mr. President. So the Senate Natural Resources and Energy Committee did look at the changes that the other body made to the bill formerly known as S-138, now sections 14A through the end, I believe, of S-327. And just to cut to the chase, none of the changes that the other body made were, I would say, prohibitive in our concurring. There were some things that we would have preferred to be differently, and I'm happy to highlight those. But in the end, we were satisfied enough to also concur. But just to highlight some of the changes that they made, they added some definitions because the commercial property assessed clean energy lending program does allow for not just energy improvements, but we had identified resiliency projects as well. They fleshed that out to include water conservation projects, and then gave us a definition of resilience and resiliency improvement, which we did not have, as well as a water conservation improvement. So that was all welcome. They made it so that these projects could be entered into as soon as folks were ready after January 1st, 2027. We had identified in terms of building energy standards, we had just mentioned local, state, or nationally recognized building energy standards, and they made that more specific to Vermont, which is the commercial building energy standards. And referenced that more specifically. So that was a welcome change. Under the program administrator, they did remove a section that would have, that we had included, that would have prohibited that a lender could not also serve as the administrator. And their reasoning for that was so because that provision would potentially reduce the universe of folks who might potentially be available. That was one part that we would had a preference to keep, though that didn't rise to the level of non-concurrence for us. And then they also removed a section in which we had asked the Department of Financial Regulation to basically come up with a list of appropriate entities to serve as program administrators. And the thought there was that as people are becoming more aware of this, that may not be necessary. So those are more or less the changes to the commercial properties as clean energy, and we recommend concurrence as well.
The question is, shall the Senate concur in the House proposal of amendment? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we've concurred with the House proposal of amendment on S-327. We're now going to go back. Senator from Chittenden.
I would like to move back to the previous bill, but we do not have all our senators on the floor. So with that understood, if we could go to H-583, and if I could ask senators to please remain on the floor. We have yet to put in an hour's work. So H-583, and then we will go back to 660. Thank you, Mr. President.
We will pass over the unfinished business on the governor's veto and move to 583. We have on the calendar for action H-583, which was passed by the House on May 8th of 26. It was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the Senate propose to the House that the bill be amended as it appears, starting on page 2856 of today's calendar, and that with such proposal of amendment, the bill ought to pass. Listen to the second reading of the bill.
H 583, an act relating to clinical decision-making.
I recognize the senator from Chittenden, Senator Lyons, for the report of the Committee on Health and Welfare.
Thank you, Mr. President. This is an important bill for our state and for healthcare generally in Vermont. It concerns the investment, private equity investment in healthcare services and providers. And we know that over the past several years, there's been growing concern about the evidence of the negative impact of private equity on state healthcare systems across the country. Private equity ownership and control of healthcare providers and facilities is consistently linked with higher costs and prices for patients, lower quality, reduced access to care, increased provider burnout, moral injury, worse health outcomes, workforce disruption, service line and hospital closures, and the elimination of essential services such as maternity wards and intensive care. Vermont lacks sufficient statutory protections to prevent the corporate practice of medicine and private equity exploitation of our healthcare system. Vermont's one of only a handful of states that does not have corporate practice of medicine doctrine in statute to prohibit corporations such as private equity firms from controlling how providers treat patients. Vermont also does not require medical practices and facilities to meaningfully disclose if they are owned, controlled, or affiliated with private equity firms. This makes it effectively impossible for regulators and policymakers to assess the scope and scale of private equity's impact on Vermont's healthcare system. Currently, there's also no enforcement mechanism to deter corporations from exploiting patients and providers for private profit. As a result, Vermont patients and providers are vulnerable to exploitations at a time when our healthcare system is fragile and expensive, and more so than any point in our history. So how can we protect our Vermont healthcare facilities, our organizations, healthcare delivery from financial exploitation? This bill, H 583, aims to protect Vermont's healthcare system in three main ways. First, ban the corporate practice of medicine in Vermont statute. This doctrine exists in many states. It establishes that clinical decision-making and treatment decisions are exclusively in the hands of healthcare providers. It's meant to safeguard against non-licensed individuals or entities, such as private equity firms, from exerting control or influence over healthcare delivery. Secondly, the bill offers opportunity for reporting and requires medical providers and facilities to provide financial and ownership control information to the Green Mountain Care Board if they are controlled, owned, or invested in by a private equity firm or hedge fund. Finally, the bill offers enforcement, establishes a strong enforcement mechanism to ensure that providers can take meaningful legal action if their ability to ethically practice medicine is being interfered with or controlled by private equity firms or hedge funds. It's important to note that H 583 does not ban private equity in Vermont. It does not restrict who can invest in our healthcare system. It does not prevent providers from contracting with private companies to help them with billing administration. Passing H 583 is about protecting provider independence so they can deliver the best care they can for Vermonters. This bill ensures that patient care, not private profit, must be at the center of healthcare in Vermont. H 583 directly aligns with Vermont's principles for healthcare reform, that Vermont must ensure universal access to and coverage for high-quality, medically necessary health services for all Vermonters. The bill is an agreement that resulted from a year and a half of difficult, complex work between the healthcare advocate, healthcare provider organizations, the Green Mountain Care Board, and the Attorney General. I urge you to vote for the bill as it's presented to help protect Vermont patients, Vermont providers, and our system as a whole. So I'll move to the bill, Mr. President, and give a brief walkthrough of the bill. We have a very short amendment in the calendar that is related to the dates of implementation for the bill. For the most part, we have concurred with the rest of the bill. We concurred with the proposal as it came to us from House Healthcare. So if you will look at the bill, you'll see that Section 1 has several pages of definitions that include healthcare facilities, healthcare providers, healthcare services, also definitions regarding private equity firms, hedge funds, and management service organizations. So management service organizations being some of those organizations that healthcare might hire to do administrative or support work, not give direct healthcare services. The definitions, other definitions regarding private equity groups, private equity provider organizations, significant equity investor, and then one particular section that you'll see on significant equity investor is a definition that says that if an investor is providing 10% or more to a healthcare provider, then that would be considered to be an equity investment. This data comes from research, so it's not just picked out of the air. So the first part of the bill that begins on page 5 of the bill that I'm looking at, page 5 of 14, 9772, has limitations on control over clinical decision-making by private equity groups or hedge funds. And so this is the first thing that the bill does. It bans corporate practice of medicine. It bans private equity firms from telling clinicians how to practice medicine. So the purpose of this section is to ensure that clinical decision-making and treatment decisions are exclusively in the hands of healthcare providers, and to safeguard against non-licensed individuals or entities such as private equity groups and hedge funds exerting influence or control over healthcare delivery. Then that section continues through and provides language supporting that principle and intent. One of the key points on page 7C, a private equity group or hedge fund or an entity controlled directly in whole or in part by a private equity group or hedge fund shall not enter into an agreement or an arrangement with a healthcare facility doing business in this state if the agreement or arrangement would enable the person to interfere with the ability of healthcare providers to make healthcare decisions as set forth in the subdivision previously of the section of this part of the bill. So it is an affirmation that clinicians provide healthcare and make healthcare decisions, not funders. Then there's discussion about the type of healthcare facility that's involved in this, including sole proprietorships, partnerships, foundations, and so on. Then there is a section in here that if a healthcare provider is aggrieved by the action of a private equity group, the healthcare provider has the right to bring an action into Superior Court for appropriate equitable relief, damages, reasonable costs, or attorney's fees. The second important part of the bill is reporting. And so that begins on page 9. So this is reporting information to the Green Mountain Care Board if they have, if the facility or provider has private equity interests supporting them. And actually, on this page is the first instance of amendment that your Committee on Health and Welfare brings you, changing the date from July 1st, 2026 to March 1st, 2027, allowing for the board, the Green Mountain Care Board, to develop a process and procedure for reporting of information from healthcare facilities regarding whether or not they have, if they have an investment. There's also a section here for attestation from those facilities or individual or practices that have no private equity or hedge fund ownership or investment. So that will be a form or a process that the Green Mountain Care Board will work out with and for providers. And so each healthcare facility or management services organization in which one or more private equity groups or hedge funds holds an ownership or investment interest as of June 1st, 26 this year, shall report going forward, once the forms and the process is established, shall report about any investment in their practice. Then there is a continuing section on reporting that the after July 1st, 26, a healthcare facility or management services organization shall report the information, and we've changed that date to March 1st, 2027, again, knowing that there's time for the development of the process by the Green Mountain Care Board. There, in our amendment, we're also on this page 10, adding a little d you'll see the language in our amendment that I will describe in a little bit when I talk more fully about the amendment, but we'll be adding a section right there on page 10, the small d after little c. Then there's a section about those organizations or entities that are exempt from this regulatory process. And the first one there is nursing homes. And I would just add that nursing homes went through a really difficult time a few years ago when there was a buyout by a corporation, and the nursing homes were bought out and then failed because they were not properly administered financially. And we want to avoid that happening in the future. So nursing homes right now have a 900-page set of guidance and documents that they follow. They are also licensed through the state, and they also are overseen by CMS at the federal level, and they also are overseen by the Department of Aging and Independent Living, so they have a strong regulatory environment. Healthcare staffing companies are also not regulated in this. Federally qualified health centers, which also have their federal reporting and requirements. And then other entities whose healthcare services delivered in Vermont are provided exclusively through telehealth. Those are all excluded, and they're regulated in other ways, including through state law. Then there is information that's developed from the collection of data by the Green Mountain Care Board, and that information will be public. It will be aggregated in such a way or put in such a way that confidential information will not be exposed publicly. Although the information, and that's listed on page 11 of the bill. And then the third important piece of this bill is enforcement, and that begins on page 12 that the healthcare facility or management or services organizations that knowingly fail to report the information required in this section is liable to the state for a civil penalty of not more than $50 each day and not to exceed a total of $10,000 for each year it fails to report required information. And then there's another a healthcare facility or management services organization that makes material misrepresentation in its report under this section is liable to the state for a civil penalty of not more than $25,000. And the Attorney General may maintain an action in Superior Court to collect the penalties that are in this section of the bill. Finally, there's sharing of ownership information to improve transparency beginning in February 2027 and every 2 years thereafter. The Green Mountain Care Board will publish in its website a report regarding the information provided to the board in the bill from those healthcare providers and services that are have an investment, a private equity investment. And Mr. President, the posting for that will begin after the data is collected. So there will be a time frame, probably collected and posted by 28, 29 in that area, depending on how quickly that data comes in. The act takes effect on July 1st, 2026. May I speak to the amendment, Mr. President?
You may.
All right, thank you. So as I indicated earlier, there are some date changes to allow for either the attestation that folks are not receiving private equity money or that they will report. And that date change was from July 1st to 26 to March 1st, 27. And as I said before, allows time for the Green Mountain Care Board and others to develop the process. And then the reporting will not begin on July 1st, 26, rather March 1st, 27. And that is on page 10, that date change. And then we added that little section D, that the Green Mountain Care Board shall collaborate with relevant stakeholders to develop the process for reporting data pursuant to this section that was in the bill, and also work with the Agency of Human Services. They'll provide relevant information and data to the board. So we've added in a collaborative process between the providers and the Green Mountain Care Board to ensure that the reporting is effective. Mr. President, that is the report from your Committee on Health and Welfare. And we had some witnesses in. The vote in committee was 5-0-0. I know we had witnesses in. All I have to do is find them. So we had the Green Mountain Care Board, Attorney General, Office of Legislative Counsel, Planned Parenthood of Northern New England, Vermont Nurse Practitioners Association, Vermont Healthcare Association, Vermont Legal Aid, who, by the way, in Vermont Legal Aid, Healthcare Advocate was the group that worked with experts across the country to develop this bill, which is a significant amount of work within the bill and to get this work done. So Legal Aid deserves a great deal of praise for their work on this. Vermont Medical Society, the Vermont Association of Hospitals and Home Systems, Hospital Systems, a few local folks in medical practice, and the head of the Action Telehealth Policy Program in a national organization. So we had a lot of testimony to affirm our decision to bring the bill to the full Senate and ask you to vote for it. Thank you, Mr. President.
The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. The ayes have it, and you have proposed to the House to amend the bill as proposed by the Committee on Health and Welfare. The question now is, shall the bill be read a third time? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. Nay. The ayes appear to have it. The ayes do have it, and you've ordered third reading of H 583. Senator from Chittenden.
Thank you, Mr. President. If we could return to action on H 660. at this point.
We now have H660 for third reading. Are there any amendments prior to third reading? Oh, okay, I'm back. There is a pending amendment, and the question is, shall the Senate amend the bill as offered by the senator from Essex? Are you ready for the question? Senator from Caledonia.
Mr. President, will this be by roll call? That was requested before.
There has been a roll call requested.
Okay, thank you.
Senator from Chittenden.
Thank you, Mr. President. I didn't vote for the Overdose Prevention Center last biennium, and I didn't support it then, and I don't support it now. But I was asked during the break to not relitigate that decision, so I won't. What I would say is, looking at where we are today in 2026, with information that we've had since that vote was taken 2 years ago, I think it's important to recognize that the city of Burlington has struggled to find a facility, a space that could actually house this. They continue to look for places. It's not an easy thing to do because it's not done elsewhere in the country. Additionally, what's also important to note is that there are syringe litter that are causing real harm to our communities. In my community, just this last fall, a elementary school kid was pricked with a syringe on the playground. When I go to track meets, when I go to council meetings, when I go in my communities, people are concerned with the amount of syringe litter. So I do think we need to adjust course with the information we have today. I don't think that's relitigating this debate or this decision from 2 years ago. I see this as us recalibrating with information that we have today. So I will be voting yes for this amendment, and I was debating on doing this as a yes with explanation, which I was told that's not necessarily the best way to do it, or to state it now. But I just wanted to say that, Mr. President. Thank you.
Kudos, Senator, for doing it the best way a senator could do it. Senator from Chittenden Central.
Thank you, Mr. President. I will just briefly respond by saying that if senators will remember the original floor presentations for the OPC, one of the things in its favor is that it reduces the medical waste and litter in the surrounding area. And you have, therefore, less first responder calls coming from it. Thank you, Mr. President.
Are you ready for the question? The secretary shall call the roll.
Senator Brew.
No.
Senator Beck.
Yes.
Senator Benson.
No.
Senator Bonner.
No.
Senator Brennan.
Yes.
Senator Brock. Yes. Senator Chittenden.
Yes.
Senator Clarkson.
No.
Senator Collmore.
Yes.
Senator Cummings.
No.
Senator Yulee.
No.
Senator Hardy.
No.
Senator Harrison.
No.
Senator Hashim.
No.
Senator Heffernan.
Yay.
Senator Ingalls.
Yes.
Senator Lyons.
No.
Senator Major.
No.
Senator Matos.
Yes.
Senator Morley.
No.
Senator Norris.
Yes.
Senator Perschlick.
No.
Senator Plunkett.
No.
Senator Ron Hinsdale.
No.
Senator Bohosky.
No.
Senator Watson.
No.
Senator Weeks.
Yes.
Senator Weston.
Yes.
Senator White.
No.
Senator Williams.
Yes.
Got it. Those voting yes, 12. Those voting no, 18, and the amendment fails. Question now is, are there any further amendments prior to third reading? Seeing none, listen to the third reading of the bill.
H660, an act relating to fiscal year 2027 opioid abatement special fund appropriations.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? Senator from Chittenden.
Thank you, Mr. President. I will leave the second response to a question on the floor to the senator from Windham. I was asked yesterday about how long does HIV last on the needle? And so HIV is one of the, as I said, viruses many last several days, like COVID, and some don't last very long at all. They're not cells, they're just capsids. So the HIV will last just a few hours at the most, because it requires human cells to survive, mammalian cells to survive. So it will be gone within a few hours. But the other issue about dirty needles also can contain hepatitis C, as I mentioned earlier, which is a devastating disease. That one can last a little bit longer, and it depends upon whether or not cells are included in the discarded, of course, in the discarded needle. So it can stick around for a while, but not long. 99.9% of the virus is gone within a couple of hours. Well, that's the answer to that question. Thank you.
Senator from Windham.
Thank you. Mr. President, there was a question yesterday from the junior senator from Addison, which I believe was along the lines of who would be liable if a minor overdoses at an OPC. And like with many hypothetical lawsuits, there are two common answers. The first is, let me do some research and I'll get back to you. That was my answer yesterday. The second most common answer is, it depends. And it depends is my answer for today. So under Act 178, there is a general criminal and civil immunity for participants, staff, and property owners from civil and criminal liability, although there are some exceptions. Generally speaking, if a participant dies or gets injured solely as a result of the permitted services being rendered, the OPC is not civilly or criminally liable. That could change in the event that staff is engaging in some sort of willful misconduct or acting outside of the scope of their employment. The immunity provisions require that the OPC is operating in good faith within the guidelines established by law and the administrative rules that are being established by the Department of Health. It is important to note, though, that the law would still permit the state to investigate and prosecute any individual who sold or dispensed the drugs that presumably led to the participant's death. That offense is a felony, and investigators would not be prohibited in acquiring evidence related to this in order to hold the seller or dispenser accountable. It does get more complicated when we talk about minors, because currently the law requires an administrative body under the Department of Health to develop rules regarding the provision of services to participants younger than 18 years old. And these rules must comply with state and federal laws regarding access to and the provision to medical and non-medical treatment for substance use for minors. This is located on page 8 of the OPC operating guidelines issued by the Vermont Department of Health. So there will be administrative rules established which could impact juveniles and OPCs, and depending on what those rules are, and depending on whatever variables exist in the different hypothetical lawsuits, it is possible that one or more entities could be liable. It's also possible that they may not be liable. This all goes back to, it depends. But generally speaking, when it comes to adults, if everyone is following the rules laid out in statute and by the Department of Health, the OPC and its staff are unlikely to be civilly or criminally liable.
Are you ready for the question? Senator from Chittenden.
Thank you, Mr. President. I appreciate the Chair of Judiciary's very complicated and hypothetical answer. What is not hypothetical is that overdose prevention centers have been operating across the world since the 1980s. There are more than 100 of them, 2 of which are in the United States. And in that 40+ years, 0 people have died of overdoses at an OPC. That is not hypothetical. Thank you.
Senator from Essex.
What a crazy world we live in, Mr. President. We're talking now about all these hypothetical stuff and everything, and we're heavy into politics now as far as how we save lives or whether we agree that people should be able to use drugs at random or what's going on. Something struck me kind of funny as far as hearing the answer from the Chair of Judiciary. I just had to wonder if a 17-year-old went into the place where you could use drugs legally nowhere in the world. If they went in there and they had a vape in there and they were 17 years old, would they arrest them for the vape first, or would they try to prosecute them for the drugs that they had, or go find out where it's at? Just a question, Mr. President. That's all. Thank you.
Are you ready for the question? The question is, shall the bill pass in concurrence with proposal of amendment? If so, all in favor say aye. Aye. All opposed, nay. No. The ayes appear to have it. The ayes do have it, and we have passed H 660 in concurrence with proposal of amendment. We are passing over H 606, which brings us to S 202. S 202 was passed by the House with proposal of amendment. The question is, shall the Senate concur in the House proposal of amendment? Senator from Washington.
Thank you, Mr. President. Would respectfully ask that we postpone, or I should say pass over this item for today. Hopefully for tomorrow. Yep. S223 was passed by the House with proposal of amendment. The question is, shall the Senate concur in the House proposal of amendment? Senator from Washington. Thank you, Mr. President. Senate Natural Resources did chat about the changes made by the other body this morning, and collectively decided the following. So I move that the Senate not concur in House proposal of amendment and request that a committee of conference be appointed.
The senator has moved that the Senate not concur in the House proposal of amendment and requests that a committee of conference be appointed. Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it. The committee on conference will be the senator from Washington, the senator from Bennington, and Senator, well, yes, let me refine that a little bit. The senator from Washington, Senator Watson, the senator from Bennington, Senator Bongartz, and the senator from Rutland, Senator Williams. We have on the calendar for action, H 956, introduced on April 8th of 2026. It was referred to the Committee on Government Operations, which reports it has considered the bill and recommends that it ought to pass in concurrence. Listen to the second reading of the bill.
H 956, an act relating to approval of an amendment to the Charter of the City of Burlington relating to the Office of Racial Equity, Inclusion, and Belonging.
Recognize the senator from Chittenden, Senator Vyhovsky, for the report of the Committee on Government Operations.
Thank you, Mr. President. This is another Burlington charter. I get the privilege of presenting those. I want to start out by saying that this office already exists. It has already hired someone that has been employed in that position. What this charter is doing is simply codifying that office as our other town official positions codified into the Burlington Charter. I also want to start by saying that the Burlington City Council voted on this charter change unanimously. And if you've ever attended a Burlington City Council meeting, unanimous votes don't often happen. So, Section 1 of the charter is boilerplate charter language. Section 2 establishes the Office of Racial Equity, Inclusion, and Belonging and outlines the duties of that office. And Section 3 is the effective date. The town voted on this charter change as well with a vote of 4,959 to 3,729. And your government operation, we also heard from 2 city councilors from the city of Burlington, the director of the Burlington Office of Racial Equity, Inclusion, and Belonging, the assistant city attorney, the House sponsor, and legislative counsel, and the vote in committee was 5-0-0, and we ask for the Senate's support.
Question is, shall the bill be read a third time? Are you ready for the question? If so, all in favor, say aye. Aye. All opposed, nay. The ayes have it. You've ordered third reading of H 956. We have on the calendar for action H 293, which was passed by the House. Like January 6th of 2026, was referred to the Committee on Health and Welfare, which reports it has considered the bill and recommends that the Senate propose to the House that the bill be amended as it appears starting on page 2875 of today's calendar, and that with such proposal of amendment, the bill ought to pass. Listen to the second reading of the bill.
Thank you.
H 293, an act relating to health equity data reporting and registry disclosure requirements.
Recognize the Senator from Orange District, Senator Benson, for the report of the Committee on Health and Welfare.
Thank you, Mr. President. May I present the bill with amendment?
You may.
So this bill is basically a housekeeping bill, and it came over from the Department of Health and their request. The Department of Health, or this bill, makes targeted updates to Vermont's health status, streamlines reports, modernizes regulatory disclosure requirements, and establishes a one-time reporting requirement to support the legislator's oversight function. First, the bill makes several changes to existing requirements for the department's reports to the legislature. These changes will reduce administrative burden on the department while preserving all ongoing data collection, analysis, and public transparency functions. This will make the department's work more sustainable while also ensuring the legislature has access to information needed to support decision-making. Secondly, the bill revises statutory data sharing requirements for the Vermont Cancer Registry and the ALS Registry. The revisions in the bill are intended to clarify the conditions of registry data, disclosure, and update the status to align with changes in federal rules to ensure access to registry data for public health. These provisions ensure Vermont can fully participate in population-level cancer and ALS research while upholding rigorous privacy and ethics standards. Third, the bill includes a requirement that the Department of Health submit a one-time report by January of 2027 on the financial status and health of recovery service organizations. The report will provide information the legislature needs to provide oversight of current investments in Vermont's critical recovery resources and consider action that may be needed to enhance the financial stability of these organizations. So that's kind of an overview of what's in the bill, and then I'll go into the section by section. So Section 1 amends 18 VSA 13 Community Violence Prevention Program. It repeals the annual report to the Community Violence Prevention Program. Section 2 amends 18 VSA 155 Cancer registry disclosure requirements. It allows institutional review board or privacy board approval prior to the commissioners granting access to cancer registry data for research purposes. Section 3 amends 18 VSA 175 registry disclosure requirements for ALS, allows institutional review board or privacy board approval prior to the commissioners granting access to ALS data for research purposes. Section 3 amends 18 VSA 175 ALS reporting requirements, requires submission of an annual report on November 1st instead of January 15th. Section 5 amends 18 VSA 252 Health Equity Advisory Commission data reporting, replaces annual reporting requirements from the Health Equity Advisory Commission with a biannual report. And Section 6 amends 18 VSA 253 Health Equity Department of Health data reporting, replaces annual reporting requirement for analysis of health equity data with a report due every 3 years. Section 7 amends 18 VSA 7257 emergency service provided welfare committee reporting, repeals the annual report for emergency service provider wellness commission. Section 8 amends 2018 acts of resolve number 119, service members and veterans food service licensing, repeals an annual report regarding the number of service members and veterans who have knowledge of food-borne diseases, prevention, the hazard analysis, critical control, point principles, and other requirements to obtain food establishment licenses. And Section 9 as report on recovery service organizations on or before 2/25/27 requires the Department of Health to consult with AHS departments and recovery service organizations to submit a report to the General Assembly regarding recovery service organizations' income and expenditures between FY '24 and '26. Section 10 repeals 18 VSA 5208 Department of Health report on statistics regarding the location and depth of where deceased individuals was receiving hospice at the time of death, and repeals 18 VSA 1756 Annual Department of Health report on lead screening results. And Section 11 sets an effective date of July 1 of 2026. We heard from the Office of Legislative Counsel, the sponsor of the bill, and the Department of Health, and the vote out of committee was 5-0-0, and we ask for your support on this bill. Thank you.
The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare? Senator from Addison.
Thank you, Mr. President. May I inquire of the reporter?
The reporter is interrogated.
Thank you. I'm looking at section 10, the two repeals. And the first one repeals a report on data about the number of Vermonters who are using hospice care during end of life. And I'm wondering if that, and the second one, I think, repeals a report about lead screening. And I'm wondering if this data will still be available even if they're not doing annual reports. I understand the reporting requirements may be burdensome on the department, but the data itself is extremely important and helpful. So will they still be collecting this data, and will it still be available publicly on their website or in another source?
I thank the senator for the question, Mr. President. And yes, the data will still be available through the Department of Health.
Will it be presented publicly on the Department of Health website?
Mr. President, yes, that's my understanding from what we have heard from the Department of Health.
Okay, I would like that confirmed before third reading, just to make sure. And the lead screening report, what screening? Is this screening of children for lead? What is specifically this data this report that's being repealed?
Mr. President, I will have to get back on third reading with more definition.
Okay, that would be helpful, Mr. President. Lead screening of especially children is extremely important. Lead has severe effects on a growing brain and can lead to many long-term issues. I thank the reporter, and I really would like to make sure that this data is still collected and publicly available. This is a major public health issue. So thank you, Mr. President. I'll look for those answers before third reading.
Are you ready for the question? The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Health and Welfare? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it. And you have proposed to the House to amend the bill as proposed by the Committee on Health and Welfare. The question now is, shall the bill be read a third time? Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and you have ordered third reading of H 293. We have on the calendar for action H 642, which was passed by the House on March 25th of 2026. It was referred to the Committee on Judiciary, which reports it has considered the bill and recommends that the Senate propose to the House that the bill be amended as it appears starting on page 2880 of today's calendar, and that with such proposal of amendment, the bill ought to pass. Listen to the second reading of the bill.
H 642, an act relating to youthful offender proceedings.
The question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Judiciary? I recognize the Senator from Chittenden North, Senator Matos, for the report of the committee.
Thank you, Mr. President. As was just stated, H 642 involves the youthful offender proceedings, and I just want to give a little background on what that is. It's current law. These proceedings can happen when a young person commits an offense that would be criminal if the person was an adult. Depending on the youth's age and how serious the offense is, the youth could be treated as a juvenile in family court or as an adult in the criminal division. There is this third option, the youthful offender treatment, which is the middle ground between those two, where if the youth qualifies for this treatment, they are treated as a juvenile in the family division. They receive services from DCF. The proceeding is confidential. And if they successfully complete the terms of their probation, the case is sealed and there is no criminal record. On the other hand, if they violate their probation through this treatment, it reverts back to the criminal division for criminal sentencing. In order to qualify for this treatment, the youthful offender treatment, the prosecutor either files the case as a youthful offender treatment proceeding in the family division, or any one of the parties can make a motion in the criminal division. Either way, the family division then holds a consideration hearing to determine if the youthful offender treatment is appropriate. DCF will do a risk assessment and makes a recommendation, and the court either keeps the case in the family division or moves it back over to the criminal division for adult proceedings. If the court grants youthful offender status, the next step is a disposition hearing where the court approves a case plan and imposes conditions of juvenile probation. Now to the bill on page 2880 of today's calendar, you'll find Senate Judiciary's amendment. Section 1 concerns the procedures that occur if the youth violates the probation conditions. Under current law, the family division only has jurisdiction up until the age of 22. This creates a problem if that youth violates their probation pretty close to that 22nd birthday. And what this does is allows for the court to authorize an extension of that jurisdiction beyond the 22nd birthday of the youthful offender to address any probation issues that are there. And the court must hold a hearing when the youth violates probation, and subsection C of our amendment describes that the factors the court takes into account when deciding whether to keep the jurisdiction in the family court or send it back over to the criminal division. Subdivision C2 specifies that for the purposes of this decision, the court must consider the same factors originally in making this a youthful order. And what it will do is look at whether public safety will be protected by continuing the treatment of the youth as a youthful offender, whether the youth continues to be amenable to treatment or rehabilitation as a youthful offender, and whether there continues to be sufficient services in the juvenile court system, DCF, and the Department of Corrections to meet the youth's treatment and rehabilitation needs. If the youth fails to appear in court or for the probation hearing, subdivision D will actually allow for the court to authorize an officer to go pick up the youth and bring him in for that hearing. Section 2 of our amendment involves the rights of victims in the youthful offender proceedings. Under current law, the victim may attend and be heard at the disposition hearing. Our amendment will extend that to permitting the victim to also attend the consideration hearing. So the consideration hearing is first, and then later on it's the disposition hearing. Now they can come to that first hearing for consideration. And lastly, section 3 is just the effective date, which is July 1, 2026. We heard from, who did we hear from? Legislative Council. We heard from the Department of State's Attorneys and Sheriffs, Defender General's Office, and the Vermont Judiciary. And on a vote of 5-0-0, we ask for the Senate's support. Thank you.
Question is, shall the Senate propose to the House to amend the bill as recommended by the Committee on Judiciary? Senator from Rutland.
Thank you, Mr. President. May I interrogate the reporter?
The reporter is interrogated.
You said that this is all good up until and including age 22?
Yes.
Thank you, Mr. President.
Well, let me rephrase. All the way up until they are 22 years old. So 21 years, 364 days.
Thank you, Mr. President. I thank the reporter.
Are you ready for the question? If so, all in favor say aye.
Aye.
All opposed, nay.
Nay.
The ayes appear to have it. The ayes do have it, and you propose to the House to amend the bill as proposed by the Committee on Judiciary. The question now is, shall the bill be read a third time? Are you ready for the question? If so, all in favor say aye.
Aye.
All opposed, nay.
Nay.
The ayes appear to have it. The ayes do have it. And you have ordered third reading of H 642. Senator from Chittenden.
Mr. President, before we finish out the calendar, if I could ask for a brief recess and have the members of the Committee on Committees meet at the podium.
We'll take a brief recess. Will the Senate please come to order? We now have S 325. It was passed by the House with a proposal of amendment. The question is, shall the Senate concur in the House proposal of amendment? Senator from Washington.
Thank you, Mr. President. So the Senate Natural Resources and Energy did do a walkthrough of the changes from the other body on S325 and discussed those changes. And again, collectively came to an agreement that about not concurring. So I move that the Senate not concur in the House proposal of amendment to the Senate proposal of amendment and request that a committee of conference be appointed. Thank you.
The senator has moved that the Senate not concur in the House proposal of amendment and that a committee of conference be appointed. Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we will appoint a committee of conference. Senator Watson from Washington, Senator Bongartz from Bennington, Senator Williams from Rutland. Senator from Chittenden.
I was just going to offer a motion to.
That completes the orders of the day. You're so efficient today,
Yes.
Senator.
Thank you, Mr. President. I would move pending announcements that the Senate stand in adjournment. Okay, and they are which?
223. Conference 223.
Please disregard that partial motion. And I would move at this time that our rules be suspended in order to message the actions just taken on S223 and S325 to the House forthwith.
Senator from Chittenden has moved that the rules be suspended and S325 and S223 be messaged to the House forthwith. Are you ready for the question? If so, all in favor, please signify by saying aye. Aye. All opposed, nay. The ayes have it, and the motion carries. Senator from Chittenden.
Thank you, Mr. President. Pending further announcements, I would move that the Senate stand in adjournment until 10 a.m., Thursday, May 14th, 2026.
Are there any announcements? Senator from Windsor.
Thank you, Mr. President. 2 Climate Solutions Caucus announcements. The first, for chronological order, tonight from 4:30 to 6:30, Representative Molly Burke from Brattleboro will be being honored at the Public Transit Center, which is right down the street over there on the left. If you went to the train day, just go a little further, it's on your left. We'll be celebrating her over 18 years of service and dedication to public transportation tonight. All are invited, regardless if you're a senator or not, or a House member. The second announcement is that the Climate Solutions Caucus will be having its final meeting of the session tomorrow at lunch. We will have free pizza, per usual, and we will be discussing rising electric bills and rising fossil fuel costs and what we can do to tamp down those increased costs in light of the war in our country. Thank you.
Are there any further announcements? Senator from Washington.
Thank you, Mr. President. Senate Finance will meet at 1 o'clock.
Senator from Rutland.
Thank you, Mr. President. Government operations will also begin at 1. And if I might ask the Senate Pro Tem if there's a possibility of a very brief Rules Committee meeting after we adjourn. Thank you.
Senator from Chittenden.
I value the senator from Rutland so highly that I will immediately schedule a meeting for at the floor of the Capitol.
Are there any further announcements? Senator from Bennington.
Mr. President, the Education Committee will meet immediately after 4. We will have time for lunch afterwards, but immediately after 4 in our committee room today.
Are there any further announcements? Senator from Windsor.
I'd like to remind the senators that today is our annual barbecue and the weather is pretty foul. And I think in deference to the senator, the senior senator from Franklin, the barbecue will be held indoors. But as I will remind everybody, our wonderful cafeteria goes to a lot of effort on this. So I encourage you to, even if you have a committee meeting, go and take advantage of all that they've prepared for us and take it to whatever you're going to next. Thank you.
Senator from Bennington.
Mr. President, in this instance, I would like the committee to go straight from the floor to the committee room and to have lunch afterwards.
Are there further announcements? Seeing none, the senator from Chittenden Central has moved that the Senate stand in adjournment until 10 a.m. Thursday, May 14th of 2026. Are you ready for the question? If so, all in favor say aye. Aye. All opposed, nay. The ayes have it, and we'll stand in adjournment until 10 a.m. Thursday, May 14th of 2026.